Vinformax presents Medical Procedure. Digital nerve block. Digital nerve block is an important tool in medicine. This technique is simple to perform. It is the most commonly used and effective method of anesthesia for a wide variety of minor surgical procedures on the digits. It helps to minimize patients' discomfort and in pain alleviation. The common digital nerves are derived from the median and ulnar nerves and divide in the distal palm. The main digital nerves, accompanied by digital vessels, run on the ventrolateral aspect of the finger, immediately lateral to the flexor tendon sheath. The hand is pronated and rested on a flat, sterile surface. A standard regional anesthesia tray is prepared with the following equipment: sterile towels in 4 inches by 4 inches gauze packs, 10 ml syringe with 2% lidocaine. It is very important that the local anesthetic does not contain any vasoconstrictors, because this may lead to the ischemia of the digit. A 25 gauge needle, iodine solution, surgical gloves. First, the local area set up for the procedure is cleaned up with iodine solution. Take a 10 ml syringe and aspirate 2% lidocaine. Advantages of this approach: a 25 gauge needle is inserted at a point on the dorsolateral aspect of the base of the finger, and a small skin wheel is raised. The needle is then directed anteriorly towards the base of the phalanx. The needle is advanced until it contacts the phalanx, while the anesthesiologist observes for any protrusion from the palmar dermis directly opposite to the needle path. Now aspirate to ensure that the needle is not within a blood vessel. 1 ml of lidocaine solution is injected as the needle is withdrawn 1 to 2 millimeters from the bone contact. An additional 1 milliliter is injected continuously as the needle is withdrawn back to the skin. The same procedure is repeated on each side of the base of the finger to achieve anesthesia of the entire finger. Now the entire digit is under anesthesia, and any of the surgical procedures can be conducted without the patient feeling the pain. The advantage of this approach is the provision of anesthesia to the entire digit with a single injection, and it reportedly has a higher success rate. Typical onset time for this block is 10 to 20 minutes, depending on the concentration and volume of local anesthetic used. This should be very rare with use of an aseptic technique. Avoid multiple needle insertions. Use a 25 gauge needle or smaller and avoid puncturing superficial veins. Instruct the patient to the care of the insensate finger. Gangrene of the digits. Residual paresthesia are likely due to an inadvertent intraneuronal injection. Systemic toxicity is rare because of the distal location of the blockade.